Dozens of nurses in Hastings and Prince Edward counties are on strike. 50 registered and public health nurses walked off the job today. They have been without a contract since December. The Ontario Nurses Association says over 3 days of bargaining and a day of conciliation, the employer wouldn't budge from its original offer. Well, joining us live now with more on this and the impact it will have is Joshua Davidson Marcon, ONA Bargaining Unit President for Hastings and Prince Edward Public Health Nurses. Thank you so much for joining us on CB24 Live at noon. So first off, Joshua, I want to talk about, the impact that this is going to have on the people and the residents of the regions of Hastings and Prince Edward County. How is this going to affect them moving forward with, nurses walking off the job?
So unfortunately, the services that the nurses provide won't be able to continue because there's not the resources available left. And so those services are going to be deferred to, the community, to the primary care providers, potentially the emergency room. It'll put a strain on the other systems.
Joshua, let's talk about the issues that the nurses, want addressed in this round of bargaining. What's top of agenda for them?
So right now, the only thing left standing is wages. We haven't been able to reach an agreement on wages. In fact, the employer hasn't changed their original monetary offer of 2% and 2% over the next 2 years. Our nurses resoundingly rejected that offer 3 times since in the process. We actually also offered voluntary arbitration, which would have meant a no strike option, which would have given the most fair agreement that was available. Unfortunately, the employer declined that offer. And so we're stuck on wages, unfortunately.
How frustrating has this been? What are you hearing from your members?
So it's extremely frustrating. It's frustrating because our livelihoods are at stake. Like I said, the employer never came to the table with an additional offer. We don't believe they ever had intention to do so. Our nurses are struggling, and that's one of the reasons why the monetary argument was our biggest mandate. We are vulnerable to skyrocketing inflation as well as, the cost of living. Our nurses haven't received a cost of living increase in a very long time. In fact, we've lost well over 12% in over the last decade in purchasing power. And, we're hoping to get some of that back.
How far apart do you think these negotiations are right now? I mean, you mentioned that the employer came back, didn't really change their deal. How long do you think the strike can last?
Well, we're hoping to get back to the table as soon as possible, but unfortunately, if the employer continues to offer us the same numbers, we're not going to be able to accept those offers. Whether or not we're very far apart is hard to see because we haven't really had the opportunity to actually engage in negotiation because every time we try to come back to the table, the offers remain the same. We are willing to move on our number, unfortunately, because they haven't. We can't continue to decrease our number if they're not willing to make a change.
We've been talking about, nurses and negotiations with the province, and there's been just a lot of focus on this particular profession that provides so much service and help to our community. How do you what's your overall take on just the fact that nurses continue to be fighting for more and fighting for what they feel they deserve, and at the same time a lot of times they're getting rejected from those requests?
Yeah, I feel really sad about this because the nurses are actually underrepresented across the province. We're 20,000 nurses short, and Ontario has the worst nurse to patient ratio across Canada. So by having nurses out on strike, you're removing services that are already depleted, and the lower the wages, the harder it is going to be to recruit people into this profession. And what we need is more nurses. Unfortunately, with the treatment that nurses have continued to receive over the last, basically the history of nursing, it's hard to become a nurse because why would you do this job if the wages don't reflect what you're worth?
Well, we appreciate the update. Joshua Davidson Marcon, ONA Bargaining Unit President for Hastings and Prince Edward Public Health Nurses. Thanks for joining us.